For the last 40 years, the Objective Structural Clinical Exam, or the OSCEs, have been in place as the single most effective tool in assessment of the clinical skills of medical student, be it end of semester or the final exam. The OSCEs have many advantages. However, for students to prepare for an OSCE, there is no such tool or easily accessible and cost-effective trial. That's where Meksi comes in. Meksi provides a digital platform to conduct an OSCE strongly focused on anytime, anywhere. Meksi provides a collaborative assessment and learning tool to not only assess what students have learned, but also score them instantaneously in the absence of a professor, giving them the best chance to excel. So how does Meksi work exactly? I'm Meksi Man, and I'm here to explain how a little bit of Meksi goes a long way. Firstly, we take a look at what's going on in a flipped classroom. Students are provided with information on a topic via a lecture, and whilst one student role plays with the professor, the other students sit passively learning and waiting for their turn, a waste of precious resources. With Meksi, everyone is actively engaging and collaboratively learning whilst instantaneously being assessed. In a flipped classroom setting, Meksi can be used pre-class to highlight areas where students may have issues, in class to assess and have questions, and doubts answered in a collaborative environment to help clear each other's doubts, and after class to retest and discuss with fellow students. Currently, organizations that educate their members in rural and remote areas are taught via satellite before a lecture, which generally occurs intermittently at a central location they must then travel to, with limited to no access to peer collaboration the remainder of the time. This again has the features of the age-old didactic lecture. Whereas now, with Meksi, these doctors and organization members are able to view content material online, attend lectures with other members and centers, and then test themselves at home while collaborating with their peers remotely over Meksi, rather than waiting for intermittent meetings and having to study on their own the rest of the time. Currently, recruitment organizations source doctors through a lengthy and expensive process, having to visit doctors in their countries of origin, interviewing them and conducting some sort of interview and assessment to evaluate their skills and ability to work in the country they wish. In Australia, for example, their ability to sit a pesky. These methods, as mentioned, are not cost-effective and have a very small success rate. With Meksi, worldwide recruitment as well as its standardization becomes easier, as Meksi's instant scoring allows possible recruitment candidates to sit an exam on Meksi and then provide instantaneous feedback on the capability of the candidates against pre-selected standards, all while the recruiter can conduct it anywhere in the world. So there you have it, Meksi, the future of medical education, creating a standardized collaborative learning and assessment platform, anytime and anywhere.